all of the benefits that vaginal estrogen provides, all of the preventative care that it speaks to. So it's not just sort of remedying what might be painful sex for you. It's not just keeping the integrity of the tissue sort of bouncy and juicy and buoyant and all of this. It's also preventing you from
getting your urinary tract infections, right? So it just helps keep, just like it restores the tissue health to its maximal capacity so it can have a healthy microbiome. It can not have you leak and have frequency and urgency. It can prevent pain with intercourse. It can help bring back your lubrication. It can help that orgasm come back, which has been long either diminished or absent. It can help with arousal, that engorgement, that good feelings, the tinglies. It can help with just how comfortable it is wearing clothing, right? A lot of people have a lot of vulvar awareness all of a sudden in menopause. And so it cures those things. It actually cures them. It fixes the problem, as opposed to, adding just a lubricant or a moisturizer, which may put a Band-Aid and help relieve some of the symptoms, but it doesn't fix the problem. And so I'm of the mind, I'm a surgeon, when I can fix a problem, I want to fix it. I don't want to just put a Band-Aid on it. And so it's giving people the knowledge that here is a simple, affordable, effective treatment that will fix the problem. And why aren't people using it? It's a marketing issue. It has nothing to do with how safe and effective and good it is. And that's why I can't stop talking about it. It's so simple. This has been, listen, I'm a urologist. I love Viagra, right? What does Viagra do? Viagra gives men erections, right? And actually, if you use Cialis every day, it can help with their urinary symptoms, their frequency and urgency. So these medicines, these erection drugs are helpful for erections, for sex, and for urination. Well, vaginal hormones are great for lady arousal, for erections, and they help with urinary symptoms, and they prevent urinary tract infections, which Viagra doesn't do. So vaginal hormones, so estrogen or DHEA, is Viagra for women, and it prevents UTIs. So it's better than Viagra for women. Where is the billion-dollar marketing campaign that we had with Viagra in 1998, which changed the landscape for men forever? This has been around since the 1970s. Female Viagra has been around since before male Viagra. We have a marketing problem. That's all it is. It's just a marketing problem because it works, it's safe, it's effective, it does everything Viagra does for women, and yet we're not telling women to use it. We're not giving it out like candy. It is not free at the grocery store. It is not, it is not being talked about, and it should be. It's literally just life being this misogynistic, like different benchmarks for men versus women. And this is why I'm loud, because I take care of men and I see how we treat men. And I'm just looking here on the other side being like, what are we doing? What are we doing here?